didn't work, or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212 Choices, 212 Choices for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212 Choices. 212 Choices. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Yeah, we're back. It's Dr. Lederman from Radiosurgery New York. We're located at 38th and Broadway. We have information to send you if you wish. We're talking about cases, news articles, latest updates, how to live better, how to be healthier, how to get better treatment. That's what we're about.
A little bit of everything. And that's
well, but everything is in a direction, and the direction is better cancer treatment, better health care, how to avoid cancer, how to get better treatment, how do you make avoiding mistakes the most important part of your care.
And also, how do you make sense of it all?
How do you make sense? How do doctors think or not think? Sometimes we think. Sometimes we don't think.
Right.
Sometimes what the heck is going on? We don't know. But we're at Radiosurgery New York, 1384 Broadway, the corner of 38th and Broadway between Macy's and Times Square. We have a spacious, modern, new cancer treatment center. We take most insurances, Medicare, Medicaid. Private means we're there for you. It's not run by big boards, by drug companies. No, we're there for you. You're our boss. The patient is the president of the United States of their body.
That's right. You're right.
And the patient decides. The patient's informed. We tell the patient all the options, not one option, not two options. We don't twist. All the options. When you walk out, you can choose. You want surgery, chemo, radiation, radiosurgery, what you want. But at least you know all the options. And you'll have copies of your reports. You'll know what's going on. So there's not miles of corridors, strange faces, people telling you what not to do. No. We will know who you are. You come in. We accept most insurances, Medicare, Medicaid. We answer our phones. There's no machines. We have people who speak French and Italian and Russian and Spanish and Farsi and English and Hebrew and Russian. It's all there. So try to get answers, not confusion. See the doctor. See the chief. See the triple board certified director. Not students, not interns, not residents, not runaround. See the chief. Hear from the chief. We had an interesting phone call this week. There was a man I treated, and actually his picture is in the brain cancer booklet, which we send out. People who call in and they want to know about brain cancer.
So he's a radiosurgery celebrity.
He's celebrity. Well, people don't know the names. And all these people we talk about, no one knows their names.
Of course.
We don't give names, so there's privacy. Everyone deserves their privacy. But this man's son called up, and he said, you probably don't remember me. And I said, what do you mean? I remember you very well. I think of your dad every day. He's in my booklet. You know, every day I show people these pictures and results and before and after, and every day I remember vividly your father. Well, his father had metastatic cancer to the brain. So usually someone who has brain metastasis have a very short lifespan and very bad outcome. His dad was treated by us many years ago. We were the first in New York to perform brain radiosurgery and fractionated brain radiosurgery, and we have the longest track record. And he called up and he said, you gave my dad 10 years when everyone said he wouldn't live months. 10 years. And I said, thank you. I appreciate that. And he said, now, if you can help me out. I said, okay. So this man is divorced. His ex-wife has a boyfriend with a brain tumor.
Okay.
They haven't spoken in 20 years.
Oh, gee.
Okay?
Yeah.
The ex-wife and the son of this patient haven't spoken in 20 years. But she knew about the dad.
Mm-hmm.
She knew how great he did.
Yeah, sure.
So after 20 years, what did she do?
She picked up the phone?
She picked up the phone. Okay, you can imagine that?
She's back.
She's back. Her boyfriend has a brain tumor, and they want to come to Radiosurgery in New York. They want the treatment like her ex-husband's dad had.
Because it worked.
And they have proof. I mean, that's a nice thing. They have proof. I mean, we can talk about it on the radio, and you can say, maybe the doctor's just tooting his own horn.
Sure.
It's never good to toot your own horn. But here's the patient's ex-wife, unheard from 20 years, calls up and said, I want to get a treatment like your dad had.
Yeah. Results speak for themselves. I mean, that's apparent.
And this
in all
man's
walks of
actually a
life.
doctor.
Is he? Yeah.
The son of the patient is a doctor. So I sent him a booklet, and I said, here's our latest booklet. We're at 2 and 2 Choices, 38th and Broadway, and I'm happy to see him. This has happened yesterday, so we'll probably see and talk about him in the next week's show.
Yeah, keep us updated.
Yeah.
For sure.
And we had another patient, actually several other patients. Gosh, time goes too fast. We got to get more time on the show. What do you think?
Let's see what we could do, Doc.
Yeah.
We're approaching the end of the hour here.
No, let's stretch it out. I'm going to I'm going to stretch it out and tell you another case.
Okay, let's do it.
Okay, so here's a man. He's born in Hong Kong. He had a PSA of 1.8. You say, wow, PSA
good,
1.8.
Right?
It's pretty good. Pretty good.
I've
pretty
learned that
good.
from sitting with you all these weeks.
But normal PSA is considered under 4, so he's pretty good. But his urologist feels prostate and does a biopsy. And he finds a Gleason 8 cancer. Now, Gleason is a man who described biopsies of cancer and describing multiple areas and giving it a more defined prognosis.
Gotcha.
So the higher the numbers range from 2 to 10. So 2 is almost never seen, but 10 is. And this man had a Gleason 8. So he had a paradox that the PSA was very low.
Yeah.
Relatively speaking.
And then it went
and the
pretty
Gleason,
high.
No, not it stays pretty low, but the Gleason score, the cancer under the microscope, looked pretty aggressive. So it's a paradox. So the patient came in yesterday morning, and I looked over the documents. We called his doctors. We got the documents and got some other documents. And I looked on the pathology report. The doctor had written elevated PSA, but it wasn't true. He had a low PSA. So then we called the pathologist. No one had ever done this for this man before. So I got on the phone. I called the pathologist. I said, I want to speak to the man who read this report directly. Mm-hmm. And the phone was on speakerphone. The patient heard the whole conversation. I said, look, this is really strange. The PSA was 1.8, and you're reading it as a Gleason 8. And the pathologist said, well, on the report it said it was an elevated PSA. I said, that's not true. It was a mistake. It was a low PSA. Now, I'd like you to re-review it. And he brought out the slides, and he re-reviewed it while we're on the phone with the patient there.
Yeah, good.
With the patient there.
That's the way to do it.
No one had ever done this for this patient. And he said, look, it's Gleason 8. It's high grade. I said, well, I'd like to get an outside review. Let's send it to a big pathologist who specializes in cancer. He wasn't offended. Sometimes patients think you're offended. No. We want to get the exact information for each patient. Mm-hmm. So we're getting a re-review. And then I said, we really should get imaging of your prostate and pelvis area to make sure the cancer hasn't traveled through the capsule, it hasn't traveled in seminal vesicles, hasn't traveled to lymph nodes. And he agreed. So in an hour and a half, we were able to get re-review of his pathology by the primary pathologist, the pathologist to be sent out to another expert in the field, imaging to see exactly where the cancer is, all within an hour. And it was never done. He had been seen by other doctors. It was never done.
Sure.
So he's going to come back next week. We're going to have the path review. We're going to hopefully have all that information available. We'll review it and give him the best possible information about where his cancer is and what the best options are. And we know for Gleason 8, you're much better to come to us. Our success rate's around 70-80% compared to surgical 30%. So you should know in advance, and you're more likely to keep your sex life and urinary life and avoid radical and cutting and bleeding and all the complications that we talked about earlier in the show. So we're just about at the end of the hour. It's been great to talk with you. It's been great to have you, John.
Yeah, thanks, Doc. Always a pleasure.
If you have questions during the week, call us at 212-CHOICES. 212-CHOICES, which is 212-246-4237. We're at 38th and Broadway. We have this information to send out to you at no charge. So give us a call. We wish you well. You have a great week.
Have a great week, Doctor. Thank you.
If you want to listen to us tomorrow, we're on Radio 710. Thank you, and
Thanks
God bless
for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Dave Packer. We're getting early results from the Winter Olympics in Sochi.